Sanibonani Kamangu Nosipho, welcome back to my channel. Today's video is going to be our very first episode in the Ask Dr Nosi series. Really excited about the series because I get to share two of my passions, my passion for medicine and my passion for content creation. So about a week ago, I announced on my Instagram that I was going to do this series, and I asked you guys to ask a few questions, and I wanted to start with feminine health and gynecology, and that's what I asked you guys to send through questions about. You sent through a lot of questions about feminine health and gynecology, so thank you so much for all of your questions. I appreciate them so much. I'm really still hoping I can make this a one-part video. If it's going to be too many questions, I will split it into two, but it will come one after the other, so it's not one very long video. So today we're discussing feminine health, feminine anatomy, we're discussing sex, we're discussing pregnancy, abortions, all those questions, periods too, that you guys asked in my DMs. I'll be answering for you guys today. So if you're interested in asking me, Dr. Nosi, some questions, or I guess hearing the answer that I have to the questions that other people ask me, if you ask nothing, then do keep watching. Thank you so much for supporting my channel. But until the next clip, I love you all so much, and God ever stay blessing you. The next question is, could irregular periods be a sign that you will have difficulty conceiving or have challenges while you're pregnant? So the causes of irregular periods, very wide array. Something as simple, like I mentioned, from obesity to taking contraceptives. Yes, there are some people who are taking contraceptives, especially the ones with progesterone, that do make your period irregular, who'll be taking contraceptives and trying to fall pregnant and wonder why they're not falling pregnant. It happens, believe me. To fibroids, as I mentioned before, to PID because you've had STIs that you haven't treated. Wide array of things that can result in irregular periods. It's not necessarily just one thing. So it's more what the cause of your irregular periods is that may have an impact on your pregnancy, as opposed to just having the irregular periods. If you're just a person who has an irregular cycle because your cycle is a little bit shorter than somebody else's, or but within the normal range, or a little bit longer than somebody else's but still within the normal range, you probably won't have any issues while you're pregnant. But if your cause for your irregular periods is because you have fibroids, then definitely that will probably affect your ability to conceive and affect you during your pregnancy as well. So it's not a direct cause and effect, but it definitely depends on what the cause for your menstrual irregularity is, as opposed to just having menstrual irregularity. The next question is, overall at-home hygiene, what's necessary and what's just too much? So in terms of feminine hygiene, as I mentioned, you really don't need to do very much for your vagina. It can do everything itself. So as long as you're washing your vagina with water, keeping it clean, cotton panties, changing your underwear regularly, making sure you stay clean, i.e. bath every day, if you've done those things, you literally have done as much as you need for your vagina to stay clean. Shaving is also something that I highly recommend for most people, if not everyone. I know that it's a counterplay between getting the shaving bumps versus not shaving, but it definitely helps, especially if you're somebody who uses pads as opposed to tampons. If you shave, then you don't have like hair just stuck all the way down there. It means nothing is trapping your sweat, and that obviously means you'll smell less. But all the other things, like all these other additive ingredients, you don't need. It's more just the routines that you follow. So what I would suggest, for instance, what a daily routine would be to bath every day. And then when you bath every day, do make sure that you rinse out and wash your vagina properly with just plain water. That's more than enough. And then in terms of shaving and waxing, if you can bear the pain of waxing, I would highly recommend that you wax, because waxing pulls that hair out all the way from the root, decreases your chances of getting ingrown hairs, also decreases your chances of having the discoloration from those ingrown hairs, and it also keeps your hair away for longer periods of time. I wish I can get to the point where I'm comfortable waxing. I'm trying to build myself to that point, but if you have waxing pain, you can always also go to Dis-Chem Clicks, any pharmacy, get some Emla cream, which is like an anesthetic cream, put it over the area an hour before you're going to wax, then you're going to wax pain free. So I would definitely suggest that you wax or you shave, and if you can afford it, just go for laser, just get that hair gone forever, which would be the ultimate goal. It's pricey though, but it is also like good part of hygiene. Another thing that you probably should do, which people might not be aware that they need to do for their vaginas, or at least around their vaginas, is to exfoliate. It's really important to exfoliate around your vagina, maybe once or twice a week with like mechanical exfoliant, so anything that has like a little bit of beads in it or some roughness in it, like those sugar scrubs, for instance, just to like exfoliate around the area, especially if you have ingrown hairs and darkness. That's going to make sure that that hair comes up to the surface. It's going to take off all that dead hair that's over the surface of your vagina. You're going to have a much better looking vagina if you exfoliate it, the same way you have a much better looking face if you exfoliate it. So exfoliation is a plus, something that I would say you should add to your weekly routine and do. But over and above that, you don't need to do anything for your vagina. That's more than enough for you to do for your vagina. After you've done that, you should be fine. Douching, don't do. Your vagina can manage its pH. Vaginal washes, you don't have to do. Your vagina can manage its pH. So those are the main things that I'd suggest. And then the cotton panties are just like a better preference as opposed to other types of panties, because cotton doesn't necessarily absorb sweat as much. Wearing panty liners is also a really important part of hygiene. I wasn't a panty liner person before. Disgusting, I know, because all of that gunk then goes on your underwear, then it ruins your underwear, then it's just problematic. So be a panty liner person. Panty liners are really good for you. They trap all that moisture, that discharge, and then you'll realize when you start using panty liners, you actually smell less, because all that discharge will go onto that panty liner. And you should change your panty liners throughout the day also. I've discovered there's a lot of people who literally just wear the same panty liner the whole day. The same way you're not going to wear the same pad the whole day, you need to change your panty liner. So throughout the day, maybe 3-4 hours, change your panty liner so you stay smelling fresh the whole day. Another thing that I've added to my routine that you might consider is using baby powder. So I wear the panty liners that I always wear, and then I put baby powder on them, and the baby powder also just helps to keep the moisture away from that area, so you smell less. You don't smell, and you sweat less as well because there's baby powder around there. There's also a spray that I have. I got a feminine hygiene spray. I know I've been saying no to feminine hygiene products, but I don't put this spray inside my vagina. I just spray it like around my bikini area, and that keeps me from sweating there, and that helps a lot with the smell between the thighs, you know, especially when you have the thick thighs that save lives. It keeps the smell away from that area. Don't use regular Dove to be spraying there. I find that feminine hygiene spray at a pharmacy in Auckland Park, right across, what's that, Campus Square. So that's the only place I've ever been able to find that spray, but I don't spray it on the inside, just on the outside. So baby powder, panty liners, definitely use those. And then just practice good hygiene also during your periods. That's really important. So the things you do when you're not on your period, probably double up on that while you're on your period, just to make sure you stay fresh, you don't smell, and that you also stay comfortable during that time. But over and above that, you don't need to do much more, because that would be doing too much. The next question is, which prevention method do you recommend? I've tried 3 and they all make me bleed a lot. So as I mentioned before, especially the progesterone contraceptives, those ones will make you bleed in the beginning. So if you like push past that bleeding period, the bleeding will stop, and then you should have no issues with your contraceptives. So I would suggest the Mirena. Mirena is a touch and go. It's the most expensive one, but it's the most effective one. And Mirena works for both pain and preventing the menorrhagia and all of that, and it also prevents pregnancy. It's one you keep in for 2 to 4 years, so you don't have to worry about being pregnant for 2 to 4 years. And yes, it's not 100% pearl index, but it is like 99% pearl index, which is pretty good, meaning 1 out of the 99 women is gonna have that baby coming out with that Mirena on their head. But otherwise, it's a very effective method of contraception, and people don't usually have issues with it. Another thing that's important about Mirena to note is that Mirena, because it goes into your uterus, only acts locally. Mirena isn't going to cause any issues, or shouldn't cause any issues with your skin or anything else, weight gain, none of that, because Mirena is designed to act locally. So if you're having issues with your skin or having issues with weight gain while on the Mirena, it's not the Mirena, it's something else, because the Mirena being put in your uterus literally just secretes that progesterone locally inside the uterus and nowhere else. So you don't get pregnant inside the uterus. everything happens inside the uterus and it doesn't affect anything else, which is why it's also preferred as opposed to the injection, for instance, which you inject into your bloodstream. So it prevents pregnancy, yes, but then that will affect your skin and that will affect your weight gain, because that is on a systemic level and not a local level. So Mirena is one that I would definitely recommend, the pricier one of all of them, but the most effective and the one that people like using the most, and it's the most longer term. However, if you are a person who's not very consistent with pills and you can't keep up with your pills, especially because with those packs, after you've missed 4 pills, you're basically getting pregnancies. So if you can't be consistent with pills, definitely don't go oral contraceptive, do the injectables, but be wary of the things like, for instance, I said that it's going to make you bleed in the beginning. Push past it, then you should be fine. It's going to make you gain weight. This is unavoidable, just generally across the board. So watch out for the weight gain that's going to happen. So to counteract that, obviously be more active, exercise to avoid that. But it just depends on what you can manage and what you want. The next question is it safe to use yoni pearls as a way to detox your womb? So I personally have never heard of yoni pearls. However, I know that you do not need to detox your womb. So I don't know what they are. However, I am already telling you that it's not a good idea. Don't do it. You don't need to put anything up your vagina to detox anything. That's never anything that's necessary. If you have an infection, like an STI or PID, you need antibiotics to clear your infection if that's the case. If you have any funny discharge that you have, if it's fungal, you need an antifungal to fix that. So we must give you some fluconazole. If you have anything anaerobic that we're worried about, we'll give you some Flagyl and that should clear up. But you don't need to be putting anything into your womb or into your vagina to detox it or clean it or anything of that sense, because your body is very capable, like I've said, of doing that itself. So in as much as it's definitely not a thing that you need to be cleaning your vagina, you definitely don't need to be cleaning your womb. And also the idea of that doesn't necessarily make all that much sense, because to detox your womb you need to get those yoni pearls into your cervix, into your uterus, and without a speculum, I'm not sure how anybody is going to be managing all of that on their own at home. That's not possible. So I would discourage the use of things like that, because the process itself is not something that's very necessary. You don't need to be detoxing your womb. And if you have issues, like if you're having issues with fertility, if you're having issues with menorrhagia, you're having issues with pain, like I mentioned, there's other things that we need to be looking at and figuring out what's causing that. So you don't need to detox your womb. We need to find if there's a problem that we need to fix. So I would advise strongly against using any of these detox, douche, intimate wash things, or putting anything up your vagina, or trying to get anything into your uterus, because you don't need to. So avoid those things because they're unnecessary, but beyond that they're quite unsafe, because a lot of these things are not very scientifically tested. So we don't know if it's going to affect your fertility. We don't know if it can cause you cancer, and those are really important things that you'd be worried about, or that you should consider before using a product, especially in those areas. So I would discourage the use of it, because it's not necessary, and I think it's too risky, and the risks outweigh the benefits that you could possibly get from it, which in my opinion are probably close to none. The next question is, every time I have unprotected sex, I get a yeast infection. What's the issue? So the first thing there would be, I hope that you're having unprotected sex with somebody who you know their status and what's going on with them, so that you make sure that you're always safe and protected. A lot of people don't really, or rather are too trusting of their partners, too trusting of the fact that they're within the confines of a relationship, so it should be safe to be having unprotected sex, and that's not always the case. So make sure that you stay safe sexually at all times, in and out of a relationship, because some things you can't fix and some things you can't reverse. So it's better to stay protected than to not know what's going on. So with that, men don't get yeast infections, right? Women are the ones that get yeast infections, that being candidiasis. That's what we're specifically talking about, where you have an overgrowth of yeast in your vagina, which causes the itchiness and that curdy white cottage cheese like discharge. Now the thing with yeast infections, even though men don't get them, so rather they're asymptomatic from them, they can be carriers of that yeast. So what could be happening is that the sexual partner that you're having unprotected sex with, or partners that you're having unprotected sex with, could be carriers of that yeast. So every time you have that unprotected sex, pretty much this person reinfects you with the yeast, and there are different strains of yeast. This person will reinfect you with the yeast, and then you get a yeast infection. So that's what I'm saying. It's really important to know what's going on with your partner and to be safe at all times, because you don't know what these men carry also. So it might not be an overt STI like gonorrhea where he's got like yellow discharge coming out of his penis, but like there are other things that can still make you sick that are a lot more minute that people are not very aware about. So it could be that you're just having unprotected sex with someone that's a carrier, and every time you clear it, they reinfect you. So it's a back and forth with that process, especially if it's the same partner. So what you could do is you could get your partner treated. So in this case, if your partner took fluconazole for 4 weeks, then that should clear them of yeast, because that clears the yeast in your entire body. So it's a systemic treatment of yeast, the oral fluconazole, and then they should no longer have any yeast that they carry, and then they should no longer reinfect you. So it's probably just a case of reinfection. And for you as well, if you're struggling with this yeast that comes back, because you also could just be getting reinfected from yourself, where you have a yeast infection that never completely clears, so it just pretty much flares up again here, now and again, and you kind of in your mind, I guess, coincided with your unprotected sex, but it's actually just always been there. So even with you, if you're not winning with the vaginal pessaries, not winning with the creams, then just get the fluconazole that you take orally for 4 weeks, and that's going to clear all the yeast in your body, and you shouldn't have yeast infections for a while after that. The next question is it normal to get a rash after your periods? I wouldn't think so, but what I think this could probably be is like if you're using pads, for instance, right? You're sitting on all of that wetness and the water and the sweat for a while, and that can cause like some irritation around the vaginal area, and then it gets itchy and that excoriates. But as a consequence of periods, you shouldn't be getting a rash after your period. So if it's something that's happening very often, a rash that's worrying you very much, then definitely do go see a doctor so they can examine you and have a look at this rash and let you know if there's anything that they need to do about it. But it's not a normal progression that periods directly cause a rash. The next question is, hi sis, please educate us on PCOS and cervical cancer, the fundamentals. So I'll start with cervical cancer. Cervical cancer also being another big one among the black population, in as much as fibroids are, and it's just more a lifestyle consequence that black people get cervical cancer really often, as opposed to it being something that we're more prone to innately. So cervical cancer is cancer of the cervix, as the name implies, and cervical cancer just generally by definition is a sexually transmitted infection. And the reason for this is that somebody who has never had sex in their life is very unlikely to get cervical cancer. Cervical cancer is caused by human papillomavirus, or HPV, the main strains being 16 and 18. In South Africa it's 32 and 51 if I'm not mistaken, that are the common strains that cause cervical cancer in our women. And this is basically cancer of the mouth of your womb. And the reason why I say it's a sexually transmitted infection is because in this case as well, men are carriers of the HPV virus, and then they pretty much can take HPV from one female and transmit it to the next female, and the next, and the next, and the next, and they never get affected because they don't have cervixes, obviously, but we do, which is another reason why I'm saying it's really important to know your partner and what's going on there. And if you don't know your partner, unprotected sex is a very, very risky thing to do, because you won't get gonorrhea, but then next thing you get HPV, and then you get cancer, and then it's a much bigger situation that you have to deal with. HPV, however, it being a virus, is preventable. We have vaccines for HPV, and you can access these or get these at your local dischem. They do them there. You can go to your doctor to get an HPV vaccine, especially if you're below the age of 27 or 28. And the reason why the age is 27 or 28 is because they basically think by that time you haven't had all that much sex before 27 or 28. So if you get the HPV vaccine before then, it'll be more effective, as opposed to someone who's had a good amount of sex with maybe multiple partners and has already contracted a strain of the virus. So it's really important to go get your vaccination. So if you've never had a cervical cancer vaccination or an HPV vaccination, please go to your local dischem or clicks and do get one done there, or your local doctor and do get one done there. So cervical cancer cancer is really problematic because it claims a lot of lives. It's quite a serious cancer to have, and it is and can be lethal. So it's really important to screen for it. And the screening for it that we do is the pap smears. So pretty much as soon as you're sexually active, you need to go for pap smears annually. And if you're HIV positive, you need to go for pap smears 6 monthly. So if you're currently sexually active and have never had a pap smear, you need to go for one. The standard age was 30 initially, where people would go for pap smears after the age of 30, but again, this was under the preface that people are not having sex before 30. So as soon as you're sexually active, go get your pap smears. Pap smears can be done at your local clinics. You can do that at your doctor, your GP. They also do them at discount clinics, so you can get these pap smears done anywhere, so there's no excuse to not do them. And the pap smears help us decide whether or not you have any precancerous lesions, if you have any cancer, and if we need to manage it. If it's caught early, that being you have precancerous lesions, then there are things that we can do, like procedures where they can cut away the infected tissue to make sure that it doesn't spread to the rest of your cervix, and then have the cancer spread beyond a specific part of your cervix. So there's ways that we can prevent the cancer from being lethal, which is why early detection is really, really important. So please do go screen, please do go get your pap smears. It's really, really important that you do. Cervical cancer, when it gets like even more terminal, you can then have your womb getting removed completely to try prevent it from spreading to the rest of your body. It can cause problems with fertility, obviously laterally. Also, if you've had cervical cancer and we've had to do a procedure where we've had to cut off a piece of your womb, then that's going to cause problems with you being able to maintain pregnancy in the future, because that results in some cervical incompetence, which could be one of the consequences. So there are like a lot of consequences to having the cervical cancer, so make sure you screen for it, make sure you catch it early, and that we can manage it. Now, the symptoms to watch out for, which is what I was actually thinking in my mind that I should mention, would be if you have any discharge that you're not understanding, lots of discharge, even if it's a little bit, discolored discharge, foul smelling discharge, and then again, if you have discomfort during sex, so that's cervical excitation tenderness that I was speaking about earlier, is also a common symptom of cervical cancer, because obviously if that cervix is infected, if a penis is bumping up against it, that's going to be painful and uncomfortable. Then those are symptoms that we should be worrying about. If you have some bleeding that you're also not understanding, intermenstrual spotting that you're not understanding, those are things that we need to worry about. So definitely do go get those checked out, because it's quite important that you do. So yeah, cervical cancer is a big one, and it's an important one, and it's important to screen for it and to make sure that you stay protected. So first thing that you need to do after you watch this video, if you haven't, go get that vaccine. Even if you're past the age of 27 or whatever the case may be, if you haven't contracted it yet, it's still going to be active, or rather effective, for you to get that vaccine. So go get that vaccine, because you need it and it might just save your life. The next question was on PCOS. So PCOS is polycystic ovarian syndrome, where basically it's women who have immature eggs that get stuck in their ovaries, and then these eggs then eventually become multiple cysts in the ovaries, and that's why it's called polycystic ovarian syndrome. So the presentation of a person with PCOS would be that these people, because these eggs never get to fruition, that being what happens in your normal menstrual cycle, where your eggs go all the way to the end and then they don't get fertilized and then they come out, that's when you menstruate. So with PCOS, they usually have anovulation, meaning they don't have ovulation, so they don't get their periods, or they'll have oligomenorrhea or irregular periods as well. So if you're having any of those symptoms, then it's something that you should worry about. PCOS also results in increased testosterone, and when they have increased testosterone, then that's when you can have the deep voice, the hoarsening, and the scratchiness of your voice. At that period, these women can also get hirsutism, so they'll have hair, lots of hair growing all over their bodies. It can also result in acne. So if you're having like lots of acne that you don't necessarily understand very much, and it's very difficult to manage, and you have other symptoms that could be associated with PCOS, then these are things that you should worry about as well. If you have a mass that you're feeling in your abdomen, that could be that ovary that's got many cysts in it, something that you could be worried about as well. Having problems with fertility, these women can have as well, because naturally if you don't ovulate, it's unlikely that you're going to be optimally fertile. So infertility is one of the things that they experience as well. These women can also experience obesity, and that's related to the insulin resistance that they also get with PCOS as a consequence, and then they can also get diabetes as well as a consequence. So PCOS is quite a multifaceted condition. However, we treat it again with contraceptives, because those contraceptives are going to help you complete that cycle, ovulate. We can give them anti-testosterone agents to bring down that testosterone. We can manage that diabetes. Obesity can be managed with exercise. So there are ways to combat it, and there are ways to manage it. So if you're feeling like you're having the symptoms of PCOS and you're worried about them, then do seek professional help, because we can definitely help you with that, especially if you're somebody who's going to want to have children in the future, because it will definitely affect your fertility if it goes untreated. The next question is, my vagina has a foul smell after my periods. What's the cause? So this is just the natural process of how your period and your cycle goes. Period blood itself, you smelt it, doesn't smell very great. Does not smell great at all. So naturally after your period, this happens to me too. Pretty sure this happens to every single woman on the planet. Right after your period, when you still have a little bit of residual blood left, it's not frank blood, but even that discharge that comes out right after your period, you've noticed that, or you should have noticed that it's more of a brownish color, and it's not completely clear. That's just the residual of that blood that's left, that's coming out, and it's mixed in with some of your normal discharge, so the smell is a little bit offish. But this shouldn't last more than about 4 to 5 days, if not even less, and then after that should clear, and then you should go back to your normal vaginary smelling vagina. You should have no issues after that. So it shouldn't be something that lasts for too long. However, it's perfectly normal. The next question is, can you miss your periods for an entire month and not be pregnant? So a normal period cycle is about 21 to 35 days. That's how often you can have your period. So every 21 days, and then the max being 35 days. So if your period is coming within that time, that is still relatively normal. And periods themselves are not always regular every single month. So you can miss a month and not be pregnant, but obviously if you've gone on to now miss 2 months, that's outside of that 35-day window, and it's going on past now to 50-60 days, then the likelihood of you being pregnant, or there being another reason for you missing your period, could be present that you maybe need to further investigate. So as I mentioned, for instance, with people that have PCOS, they can have anovulation, so they don't have periods at all, or they can have oligomenorrhea, where they have like very few periods, like 1 period every 3 to 6 months. So that's obviously very irregular, but it doesn't mean that that person is pregnant. There's just another cause for them not having their period, or for them missing their period. And again, other things like, for instance, contraceptives will make you miss your periods or have less regular periods, with depending on the contraceptive method that you use. So missing your period for a month doesn't automatically mean that you're pregnant. However, you probably should still go and get a pregnancy test, especially if you're sexually active, because just because it's been a month and you are not necessarily out of the window of worry, it doesn't mean that you should be naive to the fact that if you're sexually active, that you could be pregnant. So if you have missed your period for a month, don't just sit and do nothing about it. Do go get a pregnancy test. You can also get these at clinics as well, at the hospital as well. You can go buy them not even over the counter, you can get them off the shelves in any of your local pharmacies. So there's no excuse to not get a pregnancy test, but it doesn't absolutely mean you're pregnant if you've missed your period for a month. The next question is, I keep getting PID. I'm convinced that it's a serious STI, but on the blood work, nothing shows up. Should my husband be treated with the meds? He doesn't have symptoms. So if you have PID, I'm not too sure. Since you're saying you've done blood work, I'm assuming this means that you've gone to a doctor. But I think I discussed PID earlier, where I mentioned the symptoms that you need to be worried about, which is that discharge that you may have, the pain that you may have. PID is very serious. It's pretty much the extreme end of what you can get if you get infected with gonorrhea, or if you get infected with chlamydia mainly. Other ones can do it too, but it's mainly gonorrhea and chlamydia. So if you have a STI that has gone untreated, you're still having this discharge, you're still having the pain, please do go get treated for it. And PID isn't too difficult to treat. You really just need antibiotics to manage it, especially if it hasn't spread too far along your reproductive tract. So PID is something that is very serious, that you need to go get treated, because you can die from it. That is the eventual consequence that you can have from it. So it's very, very serious. However, since you're asking whether or not your husband should be treated, This probably means that if you do have this STI and your husband has never gotten treated for it and you getting treated for it, I'm assuming it's resolving and then you feel like it's coming back, that just means that your husband is reinfecting you. So this goes across the whole spectrum of STIs, whichever one they may be. If one partner is infected with a sexually transmitted infection, the other partner is likely infected with the same thing as well. But obviously if you get treated, your STI is going to resolve, but your partner still has the STI. And as I mentioned with the candidiasis, for instance, men are asymptomatic with a lot of things. So just because your husband or your partner doesn't have symptoms doesn't mean that they're not actively infected. And if they keep having sex with you, especially unprotected sex during that period, they're just going to reinfect you and you'll never get better. And then multiple recurrent STIs are definitely a very big risk factor for PID. So you definitely need to get treated again for that PID, and your partner needs to get treated for the same amount of time with the same drugs to make sure that they don't have it and that they're clear. And during that time, the treatment period, that being usually 10 days or 14 days, depending on the severity of this infection that you may have, especially if you've had the severe kind that we have to admit you for antibiotics and discharge you for a certain amount of time, you can't have sex during that period because you'll reinfect each other during that time. So while you're getting treated for an STI, if it's 10 days, 14 days, 7 days, 5 days, if it's an immediate shot, you must still wait before you engage in sex with the partner that was also affected or any other sexual partner, because you'll just transmit it again or you'll just pick up another STI. So we also need to make sure you don't have sex during that treatment window, because that will prevent your treatment from being effective. So you need to get treated, your partner needs to get treated as well to make it effective, and you need to wait throughout your treatment period so that you actually do clear the infection completely before you engage in any sexual activity after that point. The next question is side effects of an IUD and which IUD is the best one to go with. So the intrauterine devices, i.e. I already spoke about Mirena, but we also have the copper T. Those are our main devices. The copper one, which does not secrete any hormones, it's just copper that pretty much just causes inflammation and irritation in your uterus. This is why you don't get implantation and you don't get pregnant. You can keep that in there for 5 years, 5 to 10 years actually. Versus the Mirena, that because it does have actual medication in there that gets secreted, you can keep in there for about 2 to 4 years. So again, I still say that the Mirena is better because the Mirena has a wider range of uses. The copper T is legit only just for preventing pregnancy, nothing else. It won't stop menorrhagia or any pain or anything like that because there's no hormones in it. It's just copper that's causing the irritation. So Mirena is definitely the better option than the copper T. However, if as an emergency contraceptive method, let's say you've had unprotected sex and you pass the window of going to get morning afters, which is 72 hours, that being 3 days and exactly 72 hours, and you still want to try prevent pregnancy, what you can do is you can go get a copper T inserted. A copper T can be inserted up to 5 days after unprotected intercourse to prevent pregnancy. Mirena, you can't do that with. You can do that with a copper T. So if you're needing a copper T to prevent you from getting pregnant because you can't take the morning afters anymore and you don't want to then take pills to then have an abortion when you do eventually conceive, copper T is your guy. But in terms of just overall betterness, which one should you try? I would say try the Mirena over the copper T any day. The next question is, why is the discharge thickish while you're ovulating? So your discharge gets thick while you're ovulating because if you think about it, your body is preparing to receive the sperm and to make the baby, and is preparing the uterine environment to get all thick and mucousy and soft and cushy and basically as best as it can be to initiate conception and eventually pregnancy. So that's why while you're ovulating, your discharge gets really, really thick because basically your uterus is just getting fertile and getting ready for that pregnancy, and then obviously that doesn't happen, and then period the next month. So that's why it gets thicker. Absolutely normal, everybody goes through it. It's what's supposed to happen so that when you eventually want to have babies, if you ever do want to have babies, then that's the optimal environment for conception to take place. And then recovery after tenderness and tearing. So I think recovery would be probably just wait until you aren't having the swelling and the pain anymore before you have sex again, because otherwise you're just going to re-traumatize your vagina and that's just going to hurt again. However, I think the main thing here would be preventing the tearing and the tenderness to begin with, and usually this is just because you had sex too early, basically. So whatever kind of sex it was, you just had sex way too early, before your vagina was ready, prepped and wet enough for you to have sex. So that's the reason why you tore, because the only reason why you can have tearing is if it's dry or if the person is being too rough. So if you can manage the person being too rough by just saying like, listen, can we please have more comfortable sex so it's comfortable for me and comfortable for you, and also do floor play enough. If you need to use lubricants, use those. Basically make sure that your vagina is ripe and ready to have sex before you do, so you don't have the tenderness and the tearing that happens after. I mean, obviously if you're going to have very rough sex and that's what you prefer, then this is going to be something that you deal with every time you have sex, but otherwise it's something that you should more avoid. But then if it's happened, then you just need to give your vagina time to heal and get better before you engage in sexual intercourse again, because like I mentioned, you're just going to re-traumatize and then you're just never going to heal properly, or it's just going to be uncomfortable for you to have sex at that time anyway. The next question says, how to prevent or treat short or insufficient cervix in pregnancy without the cerclage op. So preventing a short cervix, I don't think is necessarily something that you can do, because if your cervix is short, it pretty much is short for whatever reason. If it's congenital that it's short, then it's going to be short, versus let's say you had a operation for cervical cancer which shortened your cervix. Like I said, we sometimes do cone biopsies, cut away a little bit of cervical tissue so that we prevent the spread of the cancer. That can also result in a short cervix. So by definition, a short cervix is a cervix that's less than 5 centimeters in length, and there pretty much is nothing that you can do to lengthen your cervix. So treating it is something that isn't possible. However, in terms of cervical incompetence during pregnancy, and cervical incompetence is basically when your cervix is a little bit open while you're pregnant, and naturally while you're pregnant your cervix is supposed to be closed and not efface or get shorter throughout your pregnancy, and it should only then start opening and effacing when you're ready to have your baby, because your cervix is supposed to stay closed and shut to keep that baby and the amniotic fluid and everything inside. And as soon as it starts opening, it means your water is broken and you're starting to have birth, or to give birth rather, sorry, or you've started labor. And naturally the risk of having cervical incompetence is that if you're pregnant and your cervix is incompetent, that means that you have a very high risk of having miscarriages because your cervix is open. You also have a high risk of getting infections because your cervix being open, anything can go up that tract all the way to the baby, and then you can get chorioamnionitis and very many infections that can affect the baby as well, which we don't want to happen. So that's pretty much the definition of a short cervix, as well as the definition of what cervical incompetence is and the complications of it, or some of the complications of having an incompetent cervix. Now, in terms of managing the incompetent cervix, there really is very little that you can do to close that cervix once it starts opening, which is why cervical cerclage, which is basically a procedure that's done in 2 main different ways, where you have the McDonald one and I've forgotten the second one, but they can go via your abdomen or via your vagina, where they pretty much put a stitch at the base of your cervix, close it tight so that basically throughout that pregnancy that cervix stays closed, and then when you're close to giving birth they pretty much remove the suture and then you can push your baby out normally. That's the cerclage that she's referring to in the question. In terms of what I know, that is the only most effective method of preventing the consequences of cervical incompetence, which is why it's the procedure that we do. I have heard of people using pessaries, the same pessaries that you use when you have prolapse, like vaginal prolapse and uterine prolapse, where basically your uterus or your vagina or your bladder or pretty much any of that is coming out of your vaginal wall. So a pessary is literally just a ring that they like push up there, and that keeps your organs in your pelvis where they should be, and it just helps by providing some reinforcement and support around the cervix. However, that's not going to cure the cervix itself being open, if that makes any sense. So those are the only 2 methods, and the pessary story is like a very poorly investigated thing that they're just trying out to see if it'll have like less complications and will work better, but it's not the tried and tested method. The tried and tested method definitely is cervical cerclage. It does seem like a very scary surgery and something that is worrisome, especially if you're pregnant and you're worried about your baby during pregnancy, but the benefits of getting so clogged, especially if you have cervical incompetence, very much outweigh the risks of getting the surgery. So if you do have some incompetence, I would definitely strongly advise that you get that surgery, because it's better to get it done early rather than late, and the complications that you can have later are really just not worth not having the procedure. But the only other alternative I know is the pessaries, but it's not as reliable as the surgical option is. The next question is, how do we know we are allergic to latex? Basically, if you have any allergies, you should have a reaction to the thing. So latex, I'm assuming this question is in the context of condoms. If you are having sex and you're using condoms and you're having reactions afterwards, a lot of itching, a lot of swelling, discomfort and pain around the area after having sex, then you might have a latex allergy. But then this latex allergy also wouldn't be only localized to your vagina, so that would mean wherever you get in contact with latex, then you should have the same reaction globally, not just around your vagina. So it would just be having the symptoms and an allergic reaction to the thing that would maybe alert you to the fact that you might have a latex allergy, but it must be other places as well, and then it would be treated the exact same way that any other allergy is treated, pretty much with corticosteroids and antihistamines like allergics. The next question is, are there any supplements that can keep the good bacteria down there happy? So you can definitely get probiotics. So as we mentioned before, is that you have good bacteria in your body and you have bad bacteria body, and probiotics support the good bacteria. So they sell Flora and things like that at Discount and Clicks. You can get them over the counter. You also have reinforcements of probiotic bacteria in yogurts. For instance, the yogurt that they sell at Woolworths, I know that they have like a reinforced yogurt that they sell at Pick and Pay and stuff like that. So you can definitely eat those. That can help reinforce the good bacteria down there. But I guess the main leader of the pack would be the probiotics. They are quite pricey and expensive, and I really feel like if you have no issues generally, that being you're washing with water, you're not using intimate washes, you're not having any itchiness, any issues down there, you don't necessarily very much need them. The next question is, hey Dr. Nosi, my question is too long to fit in that box. I have small fluid-filled bumps similar to the shape of a ringworm. They are on the upper part of my vagina, on the inside of my labia, and today those bumps burst and it formed a lesion that was painful to touch. When I wipe, I bath, or I pee, and I'm not sexually active. I've recently moved into a commune and we share bathrooms. I always wipe before I use the toilet. Today I started clotrimazole vaginal cream, but it's not itchy, and there's no discharge. Okay, so to me, especially if you're saying painful bumps that burst and all of that, that to me sounds like HSV, and that's herpes simplex virus. And the reason why clotrimazole or that vaginal cream is not going to work is because that is for fungi and you have a viral infection, or what sounds like a viral infection. Again, I haven't examined you, I haven't seen these lesions, you need to go see a doctor. But I'm saying that it sounds like an HSV to me. Herpes simplex is also not necessarily 100% sexually transmitted. You can get it from other methods, but it generally is mainly from sex. But if you're not sexually active, you can get it from other methods, for instance contact transference, so you can definitely get it from that. And the treatment for that is antiviral agents like acyclovir and ganciclovir and femicyclovir. That's what you need to be taking for that. So you don't take antifungal cream. So that's also important. STIs have different treatments because they're all different and they have different agents that cause them. So if you just take one thing that you know works for something else, not always necessarily going to work for what you have at the time, because that might not be the cause of your issues. The next question is, I'm 31 years old and I've never once experienced an orgasm. I think I've experienced with everything with my husband and still nothing. I get aroused occasionally, but that's about it. I'm so frustrated and this problem is taking a toll on my marriage. Is there something wrong with me? Is it hormonal? Please steer me in the right direction. So as I mentioned already, just checking that there aren't any other questions, and that's the last of it, which I think it is. So as I mentioned, that sex is a very multi-dimensional and multifactorial situation. Sex is not just about the physical, it's about the emotional, it's about the mental, and there is such a thing as trying too hard, which can also make sex itself just as ineffective and just as laborsome. So if you are worried about the sex being good going into the sex, you can still end up having bad sex because you're worried that the sex needs to be good, you know. So it really is a multi-dimensional and a multifactorial thing that you need to figure out. But there also is a partner aspect to it, and I think I did highlight this initially, but I want to stress it again, that the partner that you're with is really important. Sexual compatibility in relationships is really, really important, especially if you want to have good sex. So if your partner isn't doing the things for you that are making those parts to be done in that circumstance, then it really also will affect your ability to have orgasms, your ability to enjoy sex, because the partner just isn't cutting it for you. So it's not just a you thing. It's not just, it could be a problem with you. It's not just, it could be a problem with your hormones, because hormones don't necessarily play all that much a role in our wanting and enjoying sex very much. It's more your mental and your physical response to the experience that you're getting that plays on how the sex will be for you. So I think it's just really important, again, to do things like go for couples counseling, go for individual counseling, see a sexologist. Those are things that exist, people who counsel you on sex, and know a lot more about sex than I probably ever will in my lifetime, and they can try pick out what the actual problem is in your sex life and what could be causing the issues in your sex life, and then they help you manage it. But also don't stress about it too much and worry about it too much and put it on yourself, because that's just going to make the situation even that much more worse, and you'll enjoy the sex even less. So for me, that's about it. I can't believe I got through these questions, guys. There were so many. There were so many questions. I also really hope that I answered them effectively. Also, the sun is like creeping up on me, so now I'm like basically against this wall. But I really hope that I answered your questions very effectively, that you guys found this video helpful. I did skip some of the questions that overlapped with other questions that I answered already, because your answer should be in another question as well. So if I didn't read out and answer your specific question, it's probably because it tied in with another answer. So I hope that you guys understand if your specific question wasn't answered. But I really do hope that you guys enjoyed the video. I hope you guys like the series. I like it very much because, like I said, I get to share my medical knowledge. I get to share my passion that I really very much enjoy, and I get to help you guys out as well, because I mean, like, the thing about cervical cancer, it's really important. The fibroids is important, STDs is important. So I really do find joy and pleasure, and I feel blessed to be able to share that information with you guys and to help you guys out, to make sure that you guys stay safe and as healthy as you possibly can. But yeah, let me know what you guys think about Ask Dr Nosi. Let me know if you guys enjoyed it. Please do engage in the comments down below. Talk to each other, talk to me. I really do like engaging with you guys. I do respond to your questions, so I really do enjoy it when you guys engage with me in my comment section down below, and that makes YouTube fun for me, fun for you, and fun for everybody. So until the next Ask Dr Nosi series video, also please do suggest what else you want me to talk about next. If you guys want me to specifically talk about sex, then we'll talk about sex, baby. Or anything else that you guys want us to talk about down below. But until the next video, I love you all so much, and God ever stay blessing you. Mwah. Till the next one.